We must keep in mind that our main goal should be that of Agenda 2030. That is the imperative of leaving no one behind, which by definition also includes leaving no person living with a rare disease behind.
The agenda and the goals remain a great source of optimism for countries and for people. The vision set out in the declaration is for a world free of fear and violence, of universal literacy, of equitable and universal access to quality education, health care, and social protection, where physical, mental, and social well-being are assured. It is anchored in the premise of leaving no one behind. And this is why the agenda is a beacon of hope for people with rare diseases and those who accompany them.
Rare diseases attract stigma and discrimination, and people living with a rare disease are excluded from participation in employment and from integrating into society properly. So what needs to be done to ensure respect for human rights for those persons living with a rare disease? And first and foremost would be to recognize and elevate the issue. And as long as rare diseases are not identified as a policy priority, we feel that efforts to address the gaps in treatment will remain marginal.
Why, we may ask, is it good that rare diseases would be a matter to be discussed also here in New York at the UN, and not only in the UN Specialized Agency for Health, the World Health Organization? In general, health systems are not adapted to rare diseases, and there is little public health policy to respond to their specific needs. Access to quality health care, overall social and medical support, effective liaison between hospitals and general practices, as well as professional and social integration, autonomy, and independence. People with rare diseases and their families would therefore benefit if health and social services would be much better linked.
The high level of complexity and low prevalence of rare diseases calls for a global approach involving well-coordinated actions at national and international level. It also requires combined efforts to promote research to improve early diagnosis and treatment.
Making sure that what the WHO is going to bring to the table next October, I believe, September, October, really includes sound policies about also rare diseases that are not only related and referred to health and rehabilitation and medical issues, but actually they should focus more on the social model as well. So whatever you do here when you talk about rare diseases, I would really encourage you to look at the 360 different facets of the life of a human being. What we're doing here is not so much talking about rare diseases, but actually you're helping member states to implement the 17 goals they agreed upon.
We must work together to ensure an equitable and affordable access to quality health services and medicines for everyone, especially people who are most in need, which also includes people living with rare diseases, among others, while ensuring that they do not face financial hardship or fall back into poverty because of their catastrophic medical expenses. This is in line with our commitment in the 2030 Agenda to leave no one behind.
Japan, as a country that has been supporting persons with rare diseases under our own universal health coverage system for more than half a century, we are grateful that the issue of rare diseases is gaining momentum as a key policy area at the United Nations. In that regard, we will not have achieved universal health coverage unless and until we ensure that persons with rare diseases are not left behind.
I want to assure you of one thing. I want to assure you of our commitment to leave no one behind in the state of Kuwait, especially those with disabilities and rare diseases, and to share with you our quest to significantly reduce the burdens of their everyday life, to prevent their discrimination and stigma, and to ensure to the best of our ability, their full enjoyment of their fundamental rights. We are, as a country, in favor of the policy direction that you are pursuing here at the United Nations, and we are in favor of the universal health care, and we are in favor of a resolution on rare diseases, and we will do all that we can to help.
Malta stands ready with you and with all member states to motivate others to come on board and work for this noble cause, so that truly no one would be left behind.
In terms of international response, the UAE fully supports elevating the issue of rare diseases on the UN's agenda. And I heard, we all heard the call for a resolution on rare diseases. And as a member state, we could ask the experts, give us something that we could work on as member states. Let us discuss it and see if it could be a standalone resolution. And all member states who are present here today would be more than happy to push this agenda forward.
Let's speed up the process together and erase the borders, opening thus our hearts and our minds. UN General Assembly resolution on rare diseases will be the first, but the most important step to finally do it.